Muy buenas tardes, mi nombre es Maggie Urquiza, soy directora de la Unidad de Biotecnología de la consultora GB. En esta oportunidad estaremos entrevistando a Brent Saunders, un reconocido líder en la industria de biotecnología. Estuvo 20 años en la industria generando más de 300 mil millones de dólares en acuerdos y adquisiciones. Su más reciente acuerdo fue con AbbVie por la venta de Allergan por 63 mil millones de dólares y hoy día está efectuando como gerente general o CEO de Bausch. Bausch. I'm sorry if I don't say the word of the name of the company correctly. Is it Bausch? Bausch, right?
Bausch+Lomb.
Bausch+Lomb, yes, but it's Bausch, okay. Así que en esta oportunidad estaremos presentándolo y haciéndole preguntas sobre bio. Thank you, Brent, for taking the time. Happy to talk to you.
Nice to see you and nice to be here.
Thank you. Well, Brent, as previously spoken, I wanted to ask you about what's the current landscape in ophthalmology and in biotech. What are your
Sure.
thoughts about that?
Yeah, so ophthalmology or eye care is a very vibrant marketplace. You know, the entire population has two eyes each, so there's quite a large market. And in fairness, there are not that many companies that are dedicated to eye care. There are a few, and there are some really good ones, but they're not many. And so one of the things that is really important is to drive innovation, because as you look at the landscape of different diseases, I think I could argue with a straight face, and I think many of your listeners would agree that your vision or your sight is one of the most precious senses that we all have, and we're fortunate to have. And when it's impaired or you lose it, it really impacts the quality of life. And so when we look at the various causes of blindness, globally, still one of the largest, most significant causes of blindness is cataracts. And in most of the developed world, like the United States, cataract surgery is a very simple 8-minute procedure. Yet many people don't have access to care or the technology to have cataract surgery. So we need to look at ways to make it more affordable and lower tech, and we need to train more surgeons to do cataract surgery to solve that as a global issue. Mm-hmm. Take a disease like glaucoma. Elevated eye pressure is mostly associated. More than a third of patients with glaucoma progress to vision loss. And that's because most of the drugs today, and there are quite a few and many generic drugs around the world that manage ocular pressure, but no one's actually solving or curing the disease. And so there's still a massive opportunity to innovate to find a cure for people suffering with glaucoma. Definitely. AMD, requires monthly or every 6 weeks, or now maybe every 12 or 18 weeks, injections to the back of your eye to a retina. And that's just to preserve vision. You don't actually restore vision that's lost. Mm-hmm. And so we need to look for novel, innovative ways to treat that, not just to lower injection burden, but to actually look for ways to solve or cure the disease. Mm-hmm. And then lastly, geographic atrophy in biotech has been a hot thing. There are two products that are one approved. I think the second one just got approved. And these are complement inhibitors, and they have very modest effect on vision. And so we have a long road of innovation for this really important problem. Mm-hmm. And there's so many other diseases that still need to be solved to preserve or restore vision, mm-hmm. That the list can go on and on. But there is a massive opportunity, or as I call it, white space, for biotech or companies like Bausch+Lomb to invest in meaningful innovation to really help the world see better, to live better, which is the Bausch+Lomb tagline is see better, live better. And it's really important. Part of our mission is to try to solve some of these issues.
Yes, absolutely. And if you have to compare, immuno-oncology, for instance, has been taking like lots of steps forward and making like great advance and progress over the past decade. And like, for instance, neuroscience that is still left behind. Where do you see ophthalmology standing right now at the moment in terms of progress? Do you think it's closer to oncology or to neuroscience?
Yeah, you know, it's interesting. When I ran Allergan, which was the job I had before this, we were in neuroscience. And so I know the area well. We were not in oncology, but, you know, ASCO is going on right now, and there's some great data that's coming out from ASCO that I was reading over the weekend. And it's really amazing how far over the last decade the industry has come in really turning cancer into a chronic disease. And then now, you know, looking at actually curing cancer, right? And so we've really progressed. So great point. So they're way ahead, and a massive amount of money has been invested in innovation in that space over the last, 15 years or more. Neuroscience, I think, also has really progressed over the last 5 years. And we're seeing more and more companies really commit to neuroscience. The company I sold Allergan to, AbbVie, has done it. You saw Bristol recently announcing a deal to buy Karuna to get into more of the neuroscience space. You do have Biogen and Eli Lilly looking at neurodegenerative or Alzheimer's, disease. But, the brain is an interesting frontier, right? We know so much about the human body, and yet we know so little about the brain.
Yeah.
And so I'm pretty optimistic about the level of investment that's going into neuroscience, that over the next 10 years, we'll make significant progress at understanding many of these areas.
Mm-hmm.
Ophthalmology is a distant third to those two in terms of level of investment.
Mm-hmm.
And it's interesting. I always say, the eye is the portal to the brain. In fact, the retina is brain tissue.
Yep.
And so this very important, connection to your brain through your eye is really not well understood. We've done okay with finding some treatments, but we still have a long way to go. And then, of course, we have some novel new things that are emerging as global pandemics, like issues like myopia.
Yeah.
And children with myopia, with all the screen time that children are spending, they're losing their distant vision, and they're not getting it back.
Mm-hmm.
And so countries like China, as an example, have really recognized myopia for children as a epidemic-like issue, and we are investing, and other companies are investing in trying to solve it. But behavioral changes are also required, and we have to figure out how to get kids off screens, and looking out into the fields and spending time outside with sunblock on, hopefully, but looking out and really exercising the muscle of their eye to solve a disease like myopia. So, long way of saying we have a lot of work to do.
Yes, there's a long road, and I think the toughest nut to crack will be to take children off the screens, like to keep them away from the screens. That would be the toughest nut to crack instead of R&D.
Well, as a father with a lot of kids, it's hard to do, and I agree with you. We need to do it. And look, it doesn't have to be absolute, but we do need to get kids outside, and we need to get kids looking farther away. On a regular basis. One of the easy things to do is when you're in a car with a kid, don't give them a screen. Let them look out the window.
True.
And exercise their eyes.
True.
It's really quite important.
Absolutely. And last question, I wanted to ask you, given Argentina has been under spotlight due to political reasons, and considering the United States is ongoing, like, it's not struggling with leadership, but they're trying to remain over the top one hub for biotech, right, in terms of R&D. Do you think that given Argentina is coming under the spotlight, do you think it has the potential required to become like an ally to the United States for drug development?
I hope so. I follow Latin America closely. I've been to Buenos Aires a few times. My wife is from Colombia, and so I'm rooting for Argentina to be successful in its current experiment in politics. Look, I think my humble opinion is that the best way to create an environment for innovation is some combination of universities and private industry, and having appropriate incentives in place and the appropriate structure. It's interesting, the U.S. has done quite well over the last few decades with this, in large part because of the great universities and the ecosystem for capitalism around medicines and healthcare. And some people will criticize that, and I understand the criticism. But that being said, I think we've done pretty well in discovering most of the major medicines in the United States. That being said, no system is perfect. And I think as we sit here today and we look at the U.S., I think our politicians and frankly the public take biotech for granted. It is a crown jewel of the United States. I don't think it's recognized as such from a popular opinion perspective. I think many other countries around the world would love to have this as a strategic capability, this biotech innovation as a strategic initiative. And I would encourage, Argentina and your new president, well, he's not so new anymore, but your new president to really look at this as an opportunity to help invest in the economy and the people of Argentina. And I think if they do that, capital will flow, because you do have good universities. You have a very talented population, a very well-educated population. And so if we can create an environment for investment, I think the industry will recognize that, and capital will flow to places like Buenos Aires or other areas in Argentina.
Yes. Well, yes, now that you mentioned, yes, biotech in the U.S., I've been working 12 years for biotech in the U.S., and It's so shocking whenever people take for granted that, well, vaccines will come out of thin air. It's like they come out of nowhere and they're here, and now they're like, I don't know, digging into details. They're like, hey, vaccines save the world. Like biotech literally has saved the world. So it's like, yes,
it's interesting when people, unfortunately, when people become ill, the first thing they want is what pill can I take to make me better, or to really stop and think, where does that pill come from, and how does it reach me? I think the industry, biotech and pharma, has not done a great job of explaining itself, and we have a lot of unforced errors with silly pricing and PR disasters. But that being said, it's still a great industry with great scientists, with great people who wake up every day trying to figure out how to solve an unmet medical need. We just need to continue to do better, to be more socially conscious about the mission that we have, and frankly, work more openly with the governments around the world to create more centers of innovation.
I fully agree. Well, thank you so much, Brent, for this interview and for taking the time to respond and answer these questions. And well, happy to know about the latest updates from Bausch+Lomb.
Well, thank you. Thanks for having me, and I really enjoyed it. And I hope to come visit Argentina soon.
Absolutely. You're fully invited. You're invited to come to Argentina anytime. I'm doing that, taking that person.
All right. Thank you.
Well, thank you so much, Brent. And bueno, espero que hayan disfrutado esta entrevista y nos vemos próximamente en otro capítulo de Biotecnología acá por Bolsar.